Todd. Marcy.
Ms. Goodwin, hi. Dr. Rhodes, Dr. Frisch.
I see you have met the Cronin twins.
Yeah.
They're scheduled for separation surgery in 10 weeks. The hospital has assembled a team from 12 different departments. Dr. Frisch is their pediatric cardiologist.
How are they doing?
I detected scattered rhonchi in both of Lily's lungs, intercostal and thoracoabdominal retractions. I'm thinking pneumonia, but I was about to order a babygram and a CBC.
Thank you, Dr. Manning. We'll handle it from here.
This echo shows significant dilation of both the right and left ventricles. If we look here at twin A,
For the record, twin A is Lily.
the aortic stenosis has significantly diminished forward flow and has compromised ejection fraction to 19%.
You're saying essentially that she's in heart failure.
She will die within the next few hours without intervention, yes.
And if she does, she takes Dot with her.
We need to consider moving up to separation surgery.
We're not prepared. We haven't rehearsed the procedure.
And even if we had, it's not an option. The surgery is scheduled for when it is so the twins can grow.
Well, I'm not taking the word of a couple fellows. Page Dr. Latham.
He's gonna tell you the same thing. The twins aren't robust enough yet to survive the surgery.
Go.
Surgery involves separating the twins' chest wall and reconstructing their shared atrium. However, we still don't have a clear enough image of their liver's venous system to determine if it can be split. In addition, Lily is now immunocompromised.
If you had to estimate the odds of success.
At this point, that both survive. 0. Lily is not strong enough.
But if we concentrated all of our efforts on Dot, would we be able to save her?
Yes, I believe so.
Hold on a second. Are we actually discussing terminating Lily's life?
We're discussing the best course of action.
Well, if, as Dr. Krasny said, the problem is Lily's underlying condition, we should be addressing that.
You mean take them to the cath lab?
Exactly. We widen Lily's aortic valve, increase her blood flow.
Too risky.
We still don't have a real grasp of the twins' vascular anatomy, the routing, how open the lumen is. We're just guessing until we open them up.
I completely agree we need a better roadmap. That's why we should first perform a transesophageal echo.
You want to put the twins under general anesthesia, waste one of the few hours we might have left so you can get a better roadmap for a procedure too risky to even try? Dr. Latham, care to wrangle your fellow?
Having to surrender a child is tragic. I'd be remiss if we didn't exhaust every opportunity to try to save her. I second Dr. Rhodes' recommendation.
All right, let's get the echo.
There doesn't appear to be much calcification on the valve. I think I can get a wire in.
Still too risky. The odds just aren't in our favor.
As I said earlier.
Taking them to the cath lab is our only chance to save both babies.
Or lose both. There are umpteen things that could prove fatal. If the balloon ruptures or the catheter perforates the heart, both babies would die instantly.
Believe me, Dr. Rhodes, I share your disappointment. This is not the outcome any of us were hoping for. But the math doesn't work. I recommend separating Dot from Lily immediately. Let's save the one child.
How about we let the parents decide?
It's a tough decision we're asking them to make. I don't want to confuse them with too many
It
alternatives.
is our duty to explain both options.
There's only one option. Separate them now so Dot can live.
The CT team is unanimously behind this recommendation.
Finally, consensus. Now, shall we?
My baby's going to die.
I'm very sorry, but at least we can save one of your girls.
No. There's gotta be something else that you can try.
Dr. Latham. Connor?
Oh, my baby. My baby.
It'll take us a little time to get prepped. Be with your girls until then.
Joshua, hold on. Todd, Marcy. Can I speak to you for a second?
Dr. Rhodes, where are the twins?
The Cronins have changed their mind. They want us to perform the valvuloplasty.
What?
We had a plan going forward that we all agreed upon.
It's what the parents want.
You went around our backs.
Yeah, because you never gave them all their options.
You had no right to push your agenda with the parents.
You told the Cronins what this procedure entails.
Yes, I did.
And they understand the risks, all the risks.
Yes. Dr. Latham, I walked them through it all.
I'll talk to them. Maybe I can walk it back.
No, it's too late. We need to proceed with alacrity and confidence. Dr. Becker, prep the hybrid suite and notify the team.
Yes, sir.
Passing the wire into the aortic valve. And I'm in. Balloon. Marty.
Gotta run a VTAC.
You tickled the ventricle.
Damn it.
Pull the wire back. Carefully.
Back in sinus rhythm.
Okay. Moving back in.
Lidocaine.
Give me the balloon.
Here?
Balloon is aligned. Dilating the aortic valve now. Marty, talk to me.
Good contractions and a better flow across the valve. Looks like it worked. Both girls are stabilized.
Where's Clancy?
He's asleep.
House. Clancy's gone missing.
Oh, no. You take Alpha Centauri, Foreman can look on Tatooine, and Cameron can set up an intergalactic checkpoint. Let's pray he hasn't got into hyperdrive. We'll never catch him.
Clancy?
I had to go where there were no windows so I could get the chip out, like you said.
God.
I can feel it. I just can't
Clancy,
grab
stop! There is no chip. We're gonna clean you up, and we're gonna go back to your room. You can't do things like this. Parents?
Results came back. The lab cannot identify the metal. Said it might not even be terrestrial.
Really?
No, you idiot, it's titanium. Like from a surgical pin. Like the kind the kid had inserted into his broken arm 4 years ago. Nice medical history.
That pin was removed 6 months after.
So what? Little piece broke off during removal.
Titanium is used to build nuclear subs. Pieces don't just break off.
Tell that to the guys on the Kursk.
And how exactly did it get from his arm to the back of his neck?
Body attacks any foreign object. Inflammatory reaction could erode it into a vein. Fragment gets a free ride.
To his lungs, maybe. Not his neck.
Yeah, an alien chip makes more sense.
Too tight?
My parents think I'm crazy.
No, they don't. They're just worried about you, that's all.
I'm not weird. It's just that weird things keep happening to me.
Slight pinch.
If you make me better, do you think the aliens will leave me alone?
I don't think they're going to be bothering you for much longer.
You lying again?
No. We figure this out, everything's going to be okay. Still with us? Pulmonary edema, stage 2 hypertensive crisis.
What is happening?
Wait outside. Get him oxygen and start him on an IV drip of sodium nitroprusside. Get them outside. Here's Clancy's DNA. And here's the DNA from that piece of his heart we just biopsied.
It's impossible. Run it again.
We already did. And once more after that.
The genes from Clancy's myocytes don't match the genes from the rest of his body.
Alien DNA.
What's this machine do?
Makes a lot of noise. And it's gonna help us figure out what's wrong with you.
You think House has lost a step?
He's fine. There. A clump of affected cells in the bone marrow of the femur. Explains the intermittent bleeding disorder.
Because I don't need to subject myself to House's torture if there's no upside.
I'm telling you, he's fine. We missed some affected cells in his heart. Explains the continuing hypertensive issues.
You said the last case really threw him, and now suddenly...
I was wrong.
So you changed your mind. Why? His brilliant ideas on this case have all been yours.
There's the reason for him needing glasses.
His leg should be functional after some rehab.
Functional? What does that mean? He'll be able to walk but not run? He'll have a limp?
If everything goes well, he'll walk, he'll run, he'll probably be even stronger than he is now. When we close him up, we'll move over to his other leg, snake a catheter up through the femoral artery and into his heart. Once the affected areas are removed, his normal tissue will step back in and do its job. He should have no more problems with his blood pressure. After confirming those areas are clear, we'll start the final procedure. I'm going to insert a needle through the pupil and get rid of the abnormal cells in the retina. Close your right eye. Can you see my face?
Yeah, it's clear.
You can throw away your glasses. We got it all. Get some sleep. You're going home tomorrow.
Thank you.
Seizing. I need clonazepam. I thought you got it all. Yeah, yell at me. That'll fix it, kid.
How does one person end up with two different sets of DNA?
We've been through this.
Our assumptions are faulty.
We've confirmed two different sets of DNA. We reran the sequence.
I didn't say the lab work was faulty. I said our assumptions were faulty. We assumed he's a person.
Of course. The aliens didn't just visit him, they replaced him.
You're being silly. What if he's not a person? What if he's two persons?
I'm not getting the metaphor.
No metaphor. Chase, you said the mom used in vitro fertilization, right?
Yeah, they had trouble conceiving.
Kid was right all along. He was implanted with something. Back when he was young, I mean really young, like 12 cells young. In vitro increases the likelihood of twinning.
But he doesn't have a twin.
Not walking around. But in vitro fertilization costs around 25 grand a pop. So doctors implant 2 to 6 embryos to make sure you get your money's worth. Problem is, there's not always enough bedrooms for all the kiddies. Two brothers get stuck sharing. There's no bunk beds, so they cuddle up to keep warm. They never untangle. He's two people in one. It's called chimerism. Unfortunately, his brother's like a bad doubles partner. Guy just takes up space, gets in the way. Plants his body, thinks he's gonna put away the easy winners. His brother just keeps swatting balls into the net. We gotta get him off the court.
So, I have a twin.
Not really. What's on the card?
Light bulb.
Start us out at 10.
I'm not doing that.
That was all me, kid. It's all right.
You're in motor function. Try 2 centimeters back.
He lives inside me.
Sort of.
That tickles. Stop tickling my feet.
You're in sensory, getting closer.
What do you see on this one?
Moon and stars. So, I am kind of weird.
We're all kind of weird.
No!
Clancy?
Got something.
What do you see?
The light. Here they come. I think.
Brainwaves indicate mild hallucination. Neurons lighting up.
Any dark spots?
Area's too fuzzy. Hallucination isn't strong enough.
Turn up the juice.
His blood pressure's already 160/110. Any higher and
Riding the short bus is better than not breathing. Take us to 100.
Area's still too fuzzy to make any kind of distinction.
Crank it up higher.
You've already exceeded the preset maximum. Next step's brain damage.
They're gonna get you. They're coming through the walls. They're gonna take you, torture you. You'll never see your parents again.
Clancy?
You got them.
Yep. We got them all.
Close them up.
Everything's gonna be normal again.
I'm sure it's just my asthma acting up. It happened with the last pregnancy, too.
Is this your second?
Yep. Well, the fun this time. Twins.
Congratulations.
Thanks. But they're not mine. I'm a surrogate. Usually Nate and Stephanie, the twins' biological parents, come with me to all my doctor's visits, but I didn't want to panic them over nothing.
Yeah, I hear some scattered wheezes. I think you're right. Uterus is compressing the lungs, exacerbating your asthma. Let's get a med-nab and 40 milligrams of IV methylprednisolone. Now, since you're here,
Ultrasound?
this isn't your first rodeo.
Baby boy is doing somersaults today. Probably the salsa I had with my eggs. Spicy foods always get him moving. His sister, on the other hand, hardly ever kicks.
Celine, have you had your anatomy ultrasound yet?
No, it's for next week. Is something wrong?
The male fetus's amniotic fluid is elevated. That can happen with twins. I'd like to get a better picture of what's going on.
Should I call Nate and Stephanie?
I think that'd be a good idea.
Dr. Halstead. This is Nate and Stephanie Addison, the twins' parents. Hi.
Hi there. I'm afraid I have some difficult news.
What's wrong?
The male fetus has something called a congenital diaphragmatic hernia. His abdominal organs have migrated into his chest through a hole in his diaphragm.
Oh my God.
It's treatable, right? There are surgical options post-birth, but due to the severity of his case, his prognosis is poor. And unfortunately, that is not all. The increased fluid is compressing the female twin, jeopardizing her growth.
You're saying she's in trouble too? There has to be something you can do.
Selectively reducing the male fetus would give her the best chance of survival. You mean?
Lose him.
I am so sorry.
Is there a chance things could stabilize on their own if we just wait?
It's possible, but in all likelihood, the fluid will continue to build, hindering her lung development.
Oh no.
The earlier we intervene, the better.
Dr. Halstead, we decided that
Celine will have the procedure. We've tried for 6 years to have a child. These were our last 2 embryos. We just can't risk losing both of them.
I'll let obstetrics know. You all right?
He just kicked. I know it's him. He's always on the right. Wait, stop.
What is it?
I can't do this.
What?
You heard Dr. Halstead. We don't have a choice.
He said there's a chance things could stabilize.
Celine, we can't risk losing both of our babies.
How about we talk this out?
I'm sorry, but I'm not willing to let him go. I can't do the procedure. I just can't.
Okay, here's the clause in the surrogacy contract. The parents have the right to request a selective reduction for any medical reason.
And the surrogate agreed to defer to their wishes.
She signed the contract.
Yeah, but she has since very emphatically changed her mind.
Okay, well, that's the funny thing about contracts. They don't really care if you change your mind.
Yeah, well, I don't care if she signed a thing in blood. Celine is not a human incubator. I won't force a procedure on her without her explicit consent.
You're not going to do anything at all, Dr. Halstead. This is a legal matter now. Let the lawyers hash it out.
I want to make sure you understand you're in clear breach of contract.
I'm sorry, but I think we should just wait and see if things stabilize on their own.
With all due respect, there is no we. It's the Addisons' decision, and theirs alone.
It's her body.
That doesn't give her the right to hold my client's fetus as hostage.
That's not my intention.
Listen, I'd hate to have to bring this to trial, because if I do, you'll be facing severe legal and financial ramifications.
Well, let's take it down a notch, okay? You're not gonna force her hand with intimidation and scare tactics.
Why don't you stay in your lane, doctor? This doesn't concern you.
Oh, no, it does concern me because you're upsetting my patient. You need to leave.
Our lawyer's not going anywhere until we figure this out.
Celine, do you want her to leave?
Excuse me. I'm Sharon Goodwin, Director of Patient and Medical Services. Is there anything I can help you sort out?
Yes. We'd like a different doctor. Dr. Halstead is clearly biased against us.
Well, that's not up to you. I'm Celine's doctor. Only she can make that decision.
Dr. Halstead, can I speak to you outside?
Ms. Goodwin?
Now. You're wrong, Dr. Halstead. You know who else can make that decision? Me. And if the Addisons aren't comfortable with you...
You're benching me?
I'm reassigning the case. Yes.
Unbelievable.
The Addisons aren't speaking to me except through their lawyer. I don't know what to do. I can't afford to be in some long, drawn-out legal battle. Maybe I should just respect their wishes. But I know they don't want this either.
That's why I'm here. I may have found another way. It's an investigational procedure called fetal tracheal occlusion. And if successful, it would allow the twins to reach viability. I mean, it could even help improve the male fetus's lung function. But hold on, though. General anesthesia always carries risks. And because of your asthma, the potential complications are increased. You would be putting yourself on the line.
I know they're not mine. And when it's time to hand them over, I'll be happy too. Because I know how loved and wanted they are. But while they're still inside my body, while their lives depend on me, I have to do what I think is best. I want to do it, Dr. Halstead.
Did our babies make it?
Dr. Dennis will be out to speak with you both shortly, but the surgery was a success. And both fetuses have strong heartbeats.
Is Celine okay?
Yeah, she did just fine.
So, Beth, you've been feeling nauseous and having night sweats? Mm-hmm. And Emily, have you experienced any of the discomfort your sisters have?
I'm the healthy one.
Not entirely. You get short of breath when I'm not doing all the work.
Want to hear Sammy's twin joke?
Sure. I'd like to hear your heart.
Man walks into a bar and says, I was dating a Siamese twin for a while, but then I got bored. Bartender says, so what'd you do? Started dating her sister behind her back. But Emily got the sense of humor. Beth got her spleen. We share it.
Oh, that's good to know. Okay, can you show me where the pain is in your pelvis?
That's right. Wait. Oh, that better not be Kathleen. Emily, she broke your heart. She has the worst taste in women. You have the worst taste in men. And we can totally see each other's faces, so if we want to fight, we FaceTime on our iPads.
Okay, you were just about to show me where the pain is in your pelvis.
I'm sorry, it's right. Ooh. She's faking. We don't feel each other's pain. We have separate nervous systems.
Emily, you're not experiencing any of the symptoms your sister's having?
No, I feel normal.
I'd like to run tests on both of you.
Sure. What do you think is wrong with Beth?
I don't know. We'll find out. Group hug.
This is weird.
Yeah.
It's just fascinating. We had a pair of conjoined twins born in Cleveland Clinic. I was part of the team that worked on them for 20 hours. And they didn't survive, but they really do.
One of them goes to church and the other is a Buddhist. They're not even registered for the same political parties. And Beth told me that when they were in college, Emily played Evita in their spring production. I don't know how they did it, what life must be like for them.
Yeah. Superficial differences in intellect.
No, on the
personality.
contrary. They're very much individuals who have probably struggled all their lives to find personal identity.
Right, but they still had to learn to regard themselves as a single living organism rather than two separate human beings in order to survive. They share a liver.
And a spleen. Look, they have separate hearts, lungs, and reproductive systems. I mean, they could each have children at the same time. It's... The lab results came in. Beth has cancer. And her sister doesn't.
Wait, so if you take out my tumor, the chemo could hurt Emily? If you can take it, I can take it.
Well, actually, Emily, the chemo we'd give Beth could seriously affect your heart condition.
That's her only option?
No. We could perform a separation.
You're recommending a separation?
It would allow us to operate on you without hurting Emily. We'd bring in a team of experts who'd perform the procedure.
Her mother was a very simple woman. She was a peach. If she could have sold us to the circus, she would have. She had her good moments, Emily. She told us when we were born, the doctor said they couldn't separate us, which was a lie. She believed we were God's wish as we were. We used to talk about what it would be like to be separated. Remember when we went to Cabo? And those guys at the resort wouldn't let us go parasailing? You made them take us up. And we were in the air and all the people on the beach were pointing at us. It felt different to be flying next to you. For one moment, I couldn't feel you. I could only feel me. You want to make me half of who I am.
I want you to live.
This is who nature intended us to be. It isn't natural to you, but what you are isn't natural to us. We wouldn't be surviving apart, we would be dying alone.
No.
No separation.
You might not survive without it.
Then we'll die together.
Alex. The ethics committee have refused to allow the hospital to take Emily and Beth's case. Unless they consent to a separation, we can't operate. It's too great a legal risk to the hospital. I'm so sorry.
Hi.
So you've heard.
I'm so sorry. I want to help.
Make my sister's cancer go away.
Beth, you need to have that tumor removed. I can set something up for you over at Loyola. They're running medical trials for people who can't tolerate chemo.
Beth. Beth.
Weak pulse. She's hypotensive. Give me a bag of LR!
Beth!
Right away, doctor.
What's happening? What's wrong? What's wrong? Somebody tell me.
Right now.
What's happening?
You start an IV.
We did an ultrasound, and it is as we suspected. The tumor is compromising the blood flow back to your heart.
Is Beth gonna be okay?
No, she's not. She has a tumor that has to be removed.
So we'll go someplace else and we'll have it removed.
It's not that simple. We can resect the sarcoma, but you will likely die from the chemo if you remain joined. You have to have a separation.
Are you serious?
Yes. Beth, if I thought there was another way, but your cancer is advancing and it will metastasize to your sister.
Yes.
What?
Yes. I consent to separation, Emily. Hell if I do, Beth.
I don't know how you feel. I don't understand.
No, don't even try.
I can't even begin to imagine how frightening this is for you to figure out who you are without your sister. But you will be with your sister throughout all of this. I'll get you a psychologist. Damn it, Emily, your sister is going to die. I cannot even begin to describe the type of pain she's in, but I can show you. The pain is only going to get worse.
Yes.
Dr. Halstead, Doris, you're with me. Copy that. Barry?
Alex Mayer, 23 slash and stab, large diagonal laceration to the abdomen. He's a little tacky. GCS 15. Get it out!
You're going back, Dad.
Get it out!
Wait, weapon still in him?
I don't know. Wasn't even a call. We were 2 blocks away, saw him on the street bleeding. Loaded him in the ambo and rolled. I can feel it inside
Whoa, whoa, Alex, keep your hands down.
I got you, Dr. Halstead. Let's transfer.
On my count. 1, 2, 3. 2% to calm him down. Thank you, boys. How's that percent coming?
On it, doctor.
Gaping diagonal incision for the right upper quad.
Evidence of evisceration?
No, I can see the base. Abdomen is still intact. Just a flesh wound. It's really clean, though.
Wash it out and stitch it up.
Irrigation?
Sir, you're a lucky man. Whoever knifed you didn't do any serious damage.
Look at this, betadine smeared all over the abdomen. The skin was prepped before the cut. I'm telling you, that incision is precise.
Back alley surgery gone wrong?
Alex, what happened?
I was desperate.
Dr. Halstead, his hand under the blood.
More betadine.
So he doused his own hands.
Alex, did you cut into yourself?
I had to get it out.
Get what out?
The person living inside me. Why don't you believe me? I'm not crazy. Something lives inside of me right here.
I hear you. I understand.
To get it out! I feel it all the time.
Alex, we're gonna help you. I promise. Sedative?
No, wait. I'm sorry. I'm telling you the truth. I can feel it inside of me. Please. Please.
What'd you give him?
5 of Versed.
2 probably would have sufficed.
He put hands on you. I was being cautious.
So what are you thinking?
Schizophrenia.
You know, that was my initial thought, but now I'm not so sure.
Seriously? That's paranoia that there's something living inside him, and his attempt to remove it is literally a textbook definition of a somatic delusional disorder.
I'm stuck on the level of premeditation. You know, sterilization with betadine, the clean incision, doing it near a hospital. Well, that kind of forethought, it's just not consistent with schizophrenic psychosis.
So he's a germaphobe with a steady hand. It doesn't mean he's not schizophrenic.
Could be true, too.
So, start him on antipsychotics and reassess when his mind's clear?
I'm just not there yet. My gut tells me it's chemical, like maybe a methamphetamine overdose. Before we go any further, let's run a tox screen, see if he's just high.
Alex's tox screen is negative for methamphetamine, negative for all drugs. In fact, he's clean.
Yeah, I saw the report.
So now can we start him on a course of antipsychotics?
I'm just still not convinced it's schizophrenia.
How? He's presented with more than enough evidence of a thought disorder to warrant the diagnosis.
Yeah, even so before today, I mean, his medical record is clean. The history doesn't track with schizophrenia.
Or meth addiction. He doesn't fit the profile of a user either.
Yeah, just because he's clean today doesn't mean he's free of the drug.
So that's what the fan is for? White noise? Dr. Charles, really?
Yes, really. White noise has been proven to trigger auditory hallucinations in meth users.
How long have you been waiting for something to happen?
7 or 8 minutes,
How long does it usually take?
2 or 3. Probably not meth. Go ahead, start antipsychotics.
2 of Haldol. Dr. Charles?
Oh my God.
Alex, get his hand, get his hand! Come, give us your... Oh my God!
Help! We need some help in here!
What happened?
He used a pen to pop the stitches, chisel through his abdominal wall.
Clearly.
All right, no time to repack. Gotta scoop and move. Saline?
Okay, call OR. Tell them we're coming immediately. Let's go.
Okay, go, go, go.
Wow. I guess there was something living inside of Alex.
I'm still not exactly sure what I'm looking at. Is it a tumor?
Possibly. Or it could be a fetus in fetu, a twin that he absorbed in utero. Either way, it's not a result of schizophrenia or meth.
How about that?
It's gotta be so rare.
To say the least. It's very cool.
How did he know not only that there was something inside him, but exactly where it was?
Beats me. I mean, after all the advances we made, splicing the genome, reprogramming viruses, mapping the brain, in this case, you know, just completely trumped by human instinct.
Everything I've learned about human nature, I still can't see things coming.
He scared you?
There's risk in our work.
I guess I realized a long time ago you choose to see the threat or the opportunity.